Good morning. My name is Dr. Lenore Jarvis, and I am the president of the DC chapter of the American Academy of Pediatrics. We're very happy to be here with you today. The DC AAP is the Washington chapter of a national organization of over 68,000 pediatricians. Our chapter alone has over 470 members of pediatricians from all over the district. I am also a pediatric emergency medicine physician at Children's National Hospital. We're here today because during COVID, many groups have been disproportionately affected and vulnerable. Children or pediatricians have noticed this as well. There are many special pediatric considerations, and we know that children during this pandemic need to be continued to be linked with quality physical health and mental health care. This session today will outline strategies for identification and response to COVID-related pediatric concerns and create next steps for future areas of growth and response to child health needs within the district. I'd like to take this time now to introduce some of our other panelists, the executive committee members of the DC chapter of the AAP. Let's start with Dr. Nia Bodrick.
Good morning, everyone. My name is Nia Bodrick, and I'm a board certified pediatrician here in Washington, DC. I currently serve as the vice president of the DC chapter of the American Academy of Pediatrics, and I'm also a pediatrician at Children's National Hospital at the ARC in Ward 8.
Thank you, Dr. Bodrick. Dr. Cornejo?
Good morning. My name is Christian Cornejo. I am also a pediatrician. I'm the current treasurer for the DC AAP chapter, and I work at Mary Center, a federally qualified health center in the Washington, Maryland area.
Thanks. And Dr. Gill Bailey.
Hello, good morning. My name is Carmen Gill Bailey. I currently serve as the secretary of the DC chapter of the American Academy of Pediatrics. I am also a pediatrician. I work as a pediatric hospitalist with Children's National, but also serve as the executive director of Children's School Services, providing health services to the schools with DCPS and some of the public charters. Very glad to be here.
Thanks, Dr. Gill Bailey. So briefly, the format, the main three things that we're going to talk about with you today in a question and answer format are physical health concerns for children in COVID, mental health concerns, and school-related questions and concerns. We will leave time at the end for audience question and answer, so please, throughout the panel, as your questions come up, put them in, and we're happy to address them at the end. As a reminder, resources can be found on the DC AAP website under the COVID section, aapdc.org, and that's /COVID-19-resources. But if you remember aapdc.org, it'll get you there. All right, let's go ahead and get started. The first question is for Dr. Bodrick. Are you noticing in the COVID pandemic that children are coming to pediatric clinics for either sick visits or their well child checks?
Sure. So fortunately, in the past couple of months where I practice, we have seen an increase of children that are coming in for in-person well child visits and non-emergent sick visits. And there are a number of practices who are also offering telemedicine or video visits for families as a way to increase access to care. And so I just like to emphasize that, most practices in the district and across the nation are putting in measures to make it safe for families to come in person.
Great. And Dr. Cornejo, we've noticed that a lot of families probably appropriately have fears surrounding coming to in-person visits for pediatric visits. What are some of the fears that you're noticing, and what are pediatricians doing to help families feel better?
Well, the main fear, of course, is related to getting sick. Not only that, but also to make our loved ones sick. So what we are doing in the clinic is we're doing different things. We are, as Dr. Bodrick was mentioning, we switch a lot to telehealth appointments, and that allows for a lot of communication that we can have with patients, and there's a lot of things that we can do with that. Some of our clinics have changed the way how they work in terms of having only well exams in the morning and sick visits in the afternoon. That allows for not being around patients who are sick. Some of our clinics also are doing a lot of screening before they come to the clinic. Some of us are taking temperatures, not only to the patient, but to the family. We're going through some screening questions. If somebody has been sick with COVID in the family, if they have fever or runny nose, and there we are acting to that. One of the things that we're trying to do in the clinics is just trying to kind of follow the CDC directions in terms of trying to keep the distance in the clinic. We're trying to make sure that we are cleaning all the areas where we can have potentially patients. We're asking our parents to stay in the cars as much as possible. We are also actually doing some of the visits in the car, when that allows us to do that. So those are one of the things that we are doing in the clinics.
Dr. Bodrick, another question for you. Who in COVID should get tested and how do they get tested?
Sure. So that's a good question. It doesn't have a very simple answer, but my recommendation would be that any person who is showing signs or symptoms of COVID-19 should contact their healthcare provider or their primary care doctor first. As many of you know, signs and symptoms can include cough, shortness of breath, chest pain, fever, a new loss of taste or smell, chills, nausea, vomiting, diarrhea. So if you're having any of these symptoms, I will call your primary care doctor first. And every practice is triaging families in different ways to decide whether or not it's appropriate for you to get tested. Also in the district for children 6 and over, you can also get tested at a number of community sites, and you can go to coronavirus.dc.gov and figure out where you can get tested. But I would just caution that regardless of wherever you get tested, whether it's at your doctor's office or at a community site, you should quarantine or stay at home until you get the results back.
Thank you, Dr. Bodrick. Dr. Gill Bailey, I think many of us have heard about racial health inequities that have happened during COVID. I certainly think that that is true of pediatrics as well. Would you care to comment on that?
Sure, absolutely. I think it's an important thing for us to take a moment to discuss. As you described, there certainly are racial disparities and the impact, the morbidity, the mortality among patients and people, communities suffering with COVID, such that we see greater sort of complications, concerns, issues, death among Brown and Black communities who are infected with COVID. That does sort of translate out and translate down to the pediatric population for the simple reason that unfortunately there are health disparities that persist, and that those health disparities are very much associated with the issues that we're talking about more and more now, which have to do with institutionalized and systemic racism in the very institutions that all of us work within. In our field, we're looking at healthcare. And so, if we take the example of a older adult person who has diabetes, and we already know that there is more diabetes among Brown and Black communities, again, for some of the reasons that we've mentioned, having to do with access to care and issues around the types and quality of healthcare available. Well, when you layer on top something like COVID, you see that the diabetes is going to increase the complications from COVID, and therefore you end up with greater complexity, morbidity, mortality, as I mentioned, in that population. And certainly when we think about pediatrics, we think about, children that have perhaps some complex health conditions. How well are we reaching them? And is our system ensuring that parts of our community that are otherwise under-resourced are having the same opportunities at care to help mitigate the complication of COVID on top of their health complexities, and to assure that they have the needed access, et cetera.
Thank you, Dr. Gill Bailey. In the interest of time, I do want to state that the www.coronavirusdc.gov is an excellent resource, and the DC AAP website, again, aapdc.org, is another COVID-related resource. Are there any other, this question is for all of the panelists, any other resources or future areas of growth that you might state are important at this time?
So I would just offer that this is an excellent time for us to really capitalize on the opportunities for collaboration. So, I work in school health, and as I work with my partners and colleagues in primary care, we're looking for opportunities to help connect families to services, to the physicals that they need, to the immunizations that they need. And I know we may talk about that later, but just looking at new and innovative ways to connect families to their health service, whether it's a mobile van or assisting with scheduling in a walk-up clinic or drive-up clinic that one of the primary care clinics is offering, I think is consistent with the kinds of approaches that help us overcome the great complexity that COVID has added to the healthcare landscape.
I think that's an excellent point, Dr. Gill-Bailey. And actually, you bring up immunizations. Why don't we transition to the topic of immunizations? I'll ask this question of Dr. Cornejo and Dr. Bodrick. Dr. Cornejo first. I have been told that immunization rates are decreasing in COVID. Can you tell me a little bit about what you're seeing and why pediatricians are concerned?
Yeah, as all of you guys know, we closed our clinics. We limited the presence of our patients because we wanted them to be at home. So that affected, the primary care services that we provide. That includes vaccines. So yes, definitely, there has been impact on the vaccines that we have been providing to patients. Now, at the same time, we're trying to catch up, and we are kind of reopening, and we are providing more services to our patients as vaccines are very important. It's very safe to return to pediatric provider, your pediatrician, to get your vaccines. We definitely don't want diseases that can prevent it, like measles, mumps, pertussis, etc. So please go to your pediatrician to get your vaccines. And now that flu season is coming, more reasons to get the vaccines.
Yes, I echo Dr. Cornejo. Please get have your child come in and get caught up on their vaccines. Flu season is here. We recommend that all children, unless there's a contraindication, 6 months and older, get vaccinated against the flu every year. And practices around the district are being creative in reaching out to families. We have here at the ARC, we have a mobile van, so families can come and drive through or walk up and get their vaccines. Some practices are extending their hours. Others are actually reaching directly out to families to let them know that they need to get caught up on their vaccines. So like we've just been saying, for the most part, your primary care home is where you should be getting your vaccines, and we're making every effort to make sure that it's safe.
Great, thank you. Dr. Gill-Bailey, what are some of the conversations that the schools are having surrounding immunizations? I've heard of no shots, no schools. I don't know if you want to talk at all about that.
Sure, absolutely. We are very excited about sort of the focus and commitment on immunization compliance across the schools and with children attending school for many of the reasons that Dr. Cornejo and Dr. Bodrick outlined. In the school setting, that is a place certainly where children are going to congregate. And once in-person learning resumes, if we are to consider that substantial proportions of the population of children in the school have not been appropriately vaccinated, then in addition to COVID, all the respiratory symptoms and complications and challenges that poses, we are potentially looking at the outbreak of a vaccine preventable disease like measles. And we can imagine the crisis that would pose to the community, but certainly the school environment itself in terms of not being able to continue learning and the likelihood of schools really thinking about whether they can continue in-person learning and having to shut down all over again. Not to mention that there are students and children and adults within our community that are very vulnerable, and a vaccine preventable outbreak like measles could be really devastating for them. So there's certainly the public health reason, and there's the individual health reason and community health reasons why vaccines are so important. In the school health setting, we are partnering with educators to reach out to families, alert them when their children are due for a vaccine, overdue for a vaccine, are not compliant with the vaccine schedule. It's a partnership, and collaboration with our school leaders to make sure families have every opportunity to get vaccines before school starts. Now, we've already begun virtual learning, but this will become even more important when in-person learning resumes for much of the DC school community and other school communities in this region. So that outreach also extends to primary care providers and the care coordination that we do with families to help connect them to the available clinics, services, federally qualified healthcare centers, in addition to great services already in place. We're hopeful that children return to school with the vaccine compliance that helps prevent the types of infections in this community that we all live and work in.
Thank you. And I actually just want to add a point here. You mentioned the importance of these vaccines and the flu vaccine. I think this is a very unique time for pediatricians where if there are diseases that we can prevent, especially diseases that cause fever, like the flu, it's going to be very confusing for us in the upcoming months to know if a child coming in with a high fever is influenza or the flu or COVID. And so anything we can do to prevent children from getting sick with a fever, I think is going to be very beneficial. So let's move on to another kind of portion of physical health that was a secondary consequence of a lot of our in-person learning shutting down. So we've noticed in COVID that a lot of our children were receiving many meals from in-person school learning. So Dr. Cornejo, this question's for you, but for children and families who are experiencing food insecurity, and now that schools have shut down, maybe that made some of their meals a little bit more uncertain during COVID times, how are pediatricians addressing some of this food insecurity?
Thank you for that question, Dr. Jarvis. I just want to start defining what is food insecurity. Is it limited or uncertain access to enough food? Before COVID, one out of 6 kids were living in a household where there was food insecurity. And as you know, nutrition will impact their brain development, their ability to learn of our patients. It's well known that patients who had food insecurity in their homes will get sicker more often. It will take longer for them to recover from the illness, and will stay longer in the hospital. So the way how we are addressing food insecurity in our clinics has 3 prongs. The first one is related to screening. We have to make sure that we are asking our patients for food insecurity. The second one is related to providing the resources for our patients to get enough food. We're talking about referring to WIC, SNAP, other organizations in the community. And the third one is related to supporting national and local policies that increase access to adequate health food for children and other families. So that's what we are doing.
Thanks. And Dr. Gill Bailey, can you tell me what role schools are playing in food insecurity?
Absolutely. So we should begin by sharing that, as most of you know, prior to COVID and before moving to virtual learning, the schools did provide meals to many students who were vulnerable and in need and were encountering food insecurity, and that was a vital part of a child's preparation for their school day, their readiness to learn. And certainly as a pediatrician, for the reasons that Dr. Cornejo have mentioned, is critical to maintaining health and wellness. And so now that we have moved into virtual learning, we have been very pleased and very excited to see that schools continue to answer the call as it relates to the need for families to continue to secure nutritious food for their families. And so schools have identified food sites where families can come to obtain nutritious meals that support their families, during virtual learning. And so this is something that the Public Charter School Board and DCPS have both committed to. I cannot recite the website right now, but would share and encourage that those of you that are joining us today, go to our DC AAP website where you can see the link that can take you directly to the information about where the sites are within the city, so that if that's a need, you can be connected to that resource.
Thank you. And to that point, I know that in addition to some of the school sites that are offering free and reduced lunches with meal pickups, there are some other resources throughout the city, nonprofit organizations such as Martha's Table, DC Greens, Capital Area Food Bank, to name a few. Does anyone else, any of the panelists, want to comment on other resources that are available?
One of the things that I'm doing actually is, and we are, I guess, very blessed at Mary Center that we have a social worker that kind of help us to connect patients to the different resources, not only related to food insecurity, but inability to pay rent and electricity and so forth. So for those who can access a social worker, social services, that's a good resource in general for this type of things.
Thanks, Dr. Cornejo. Dr. Bodrick, there is a very diverse audience watching this today. I know that there are folks on this call who are watching that are also family-facing organizations, even if they're not in healthcare. Do you have any recommendations for how family-facing organizations could best meet their client or family child need when it comes to food insecurity?
Thank you, Dr. Jarvis. Yeah, I think Dr. Cornejo did a great job of outlining the ways in which organizations can reach out to families who may be food insecure. And we know that households with children are more likely to be food insecure. And so I think just routinely asking those questions, those hunger vital sign questions, the 2 questions of if they've had enough food that will last them to the end of the month, or if they, go throughout a month and the food doesn't last, and just connecting them to resources, because what we know is that families that were food insecure prior to the pandemic are going to be, continue to be food insecure. And we also have new families who maybe this is the first time that they are food insecure. And in the district, there are a disproportionate amount of African Americans, especially in Ward 7 and 8 east of the river, who are food insecure. And as Dr. Gill Bailey mentioned earlier, these inequities are rooted in lots of things. It's not a simple answer, but that includes institutional racism, lack of access to quality foods. There's only 1 full service grocery store in Ward 8, only 2 in Ward 7. And so this is prior to the pandemic. And so then the pandemic hits, and those issues are only going to be exacerbated. And so what we are trying to do at my practice is just normalize it. And we ask those questions just like we ask any other questions about the family's health. And then, connecting them to resources, and also connecting new families to federal programs like SNAP and WIC.
Thank you. Some of these topics are tied together. We're going to transition to another physical health topic that includes child abuse and increases of, underreporting of child abuse in COVID, and concerns for increases of domestic violence or intimate partner violence in COVID. I want to speak to this just very briefly. As an emergency department physician, we see unfortunately, a lot of this coming through our doors, and speaking with our CFSA partners, our Child Family Service Agency partners, I have been told that before COVID, about 20% of the calls that they received about child abuse were coming from the schools, and that 10% were coming from healthcare professionals and about 5% were coming from mental health professionals. And there is a deep concern that now that we're in COVID, we're not hearing about child abuse. It's not being reported as often because the means of which we report it are these in-person encounters within the schools, within the pediatrician visits, and within mental health visits. Another thing that we have noticed is that some of our child abuse hotlines and sexual assault hotline calls have actually increased. And I just want to state that from the National Sexual Assault Hotline, 67% of the calls since March have been perpetuated by a family member, and 79% are currently living with their perpetrator. And so this is just something that we feel very strongly needs to be considered and addressed, that, you know, our children are not slipping through the cracks, and that, you know, as a community, we're thinking about child abuse, sexual assault, and intimate partner violence within our homes. The last thing I'll say is, you know, in the emergency department, although we may have seen a decrease in overall number of cases of child abuse and sexual assault, the cases that we have seen have been more severe, meaning that they're much worse in nature than what we were seeing before COVID. And just because there are fewer cases, it doesn't mean that we don't think those cases are happening. It just means we think that they're being underreported. So this question is for everybody, but starting with Dr. Bodrick, what are you seeing in your clinic, and what do you think are some of the best ways that we can reach out to children?
Thank you, Dr. Jarvis. Yes, underreporting is a major concern for pediatricians and really for anyone that works directly with children, especially during the pandemic, because there just aren't as many eyes on children in various settings, including our most vulnerable children. And so, you know, like I said, in the past month or two, we're starting to see more inpatient visits, which is great. But some of these are telemedicine visits, so we're not able to do a complete physical exam or have that that person-to-person interaction with our families. And so my approach has just been to have conversations with families. You know, we're living through a very stressful time right now, and it's okay for us as pediatricians or as child health providers to express that and just ask families how they're doing. And so I just ask, you know, the children, how is virtual school? You know, do you have a laptop? Are you able to connect to the internet? Any concerns with that? I ask the parents, you know, are you still working? Because some parents are unemployed now. And if they are working, are you working from home? What's it like working from home with your kids also at home? And we've noticed an uptick in just behavior change because this is a very stressful time. And so we talk about behavior with children. How do you handle when children, are not behaving in the normal fashion or quote unquote, acting out? And we just kind of talk through and problem solve and talk about these stressors as a way to prevent, you know, some of the issues that may lead to child abuse and neglect. And fortunately, we as pediatricians are able to link families to services if they need it.
Dr. Cornejo or Dr. Gill Bailey, do you have anything to add?
I would just offer that, the point you made, Dr. Jarvis, around the way that reporting would come in before COVID, and that 20% of that reporting would occur in the school setting is very concerning for those of us that work in school health, because it's the school health personnel in the school that very often was identifying a student that was unfortunately being abused, or at least had some stigmata or signs suggesting abuse. And that was the first step, if you will, to ensure that that child was safe. So in the absence of that, I think we realize that it's everyone's responsibility. If you work with children, you're a niece and you have a niece and nephew, you're an aunt or uncle, whatever your interaction or intersection is with children, we all need to sort of have an eye out looking for and considering whether, something as horrible as this is actually taking place, and go ahead and make the phone calls if needed. And, those numbers numbers are available pretty much everywhere, but I guess I just want to emphasize that it's everyone's responsibility to take care of children and ensure their safety. Pediatricians are going to do their part. We in school health, although working with teachers and educators in that virtual environment, are also thinking about how do we support teachers in doing some health and wellness screening, or offering some services even remotely to help understand what's happening with students, what kind of stressors are they encountering, and is there in fact an element of abuse taking place in the home, and what kinds of things are we looking for even if in that remote situation. It's sort of new territory for all of us, but I think because of what is at risk, it's worth considering innovative and new ways to sort of capture this percentage that we're not able to capture now that we're not in-person learning.
I think those are some great points. You know, I really appreciate the breaking down the silos, and you know, that if you see something, it sounds cheesy, but if you see something, say something. Anybody can report a concern for child abuse or sexual assault. The number for DC CFSA is 202-671-5683. You know, things you might notice are signs of injury that don't make sense, maybe some pattern bruising, or, you know, similar to what Dr. Bodrick was saying, you know, concerns for a difference in child affect, or maybe the child is saying something to you that is concerning, that certainly should be reported. And then I think, you know, Dr. Bodrick also mentioned the increased stress of COVID, and I think that's across the board for everybody, but certainly financial concerns, potentially being at home, you know, for longer durations of time with a abuser. And so the last kind of thing I'll state here is that if you are in immediate danger, call 911. But if you need confidential help for intimate partner violence 24/7, you can call the National Domestic Violence Hotline at 1-800-799-SAFE. And those resources are also available on the DC AAP website, aapdc.org. I'd like to transition now, mostly in the interest of time, we've talked a lot about physical health, but I think just as important, or maybe even sometimes more so important consideration in COVID is mental health concerns. So I was surprised to hear recently from someone that just assumed that children's mental health has probably improved during COVID because they're not in-person learning, and so they're not getting bullied as much. And, you know, I can tell you firsthand, and I'll open it up to the panelists here, but that in fact is not always what we are actually seeing. So I'll start this question to Dr. Cornejo, but what are some of the mental health concerns that you've seen among your patient population?
Yeah, I mean, besides the physical impact of COVID, definitely COVID has impacted the mental health of our patients. Kids can be overwhelmed by stressful situations, especially by traumatic events. And I think that COVID-19 is a traumatic event. Patients will express, when they can, older kids will express anxiety, fear, will express sadness. Kids who are a little younger will express emotional distress in different ways. They will, have behavioral changes. They will have problems sleeping, sometimes refusing to eat. The famous "my tummy hurt," and those are signs kind of guide pediatricians to start asking about what's happening with them, what's happening at home, how are parents feeling. COVID-19 has disrupted everything, has disrupted routine, has disrupted school, vacation plans. You just cannot go to eat ice cream as you used to. So all these create emotional distress in our patients. So that's what I wanted to mention that.
Sure, and Dr. Gill Bailey, Dr. Bodrick, do you have anything to add?
I was just going to offer that in addition to what Dr. Cornejo was describing from a developmental point of view for younger children, very often when they're encountering stress and traumas, you can see a regression in developmental milestones that they otherwise had achieved. So that can sometimes be an indication that they are really struggling with the general disorder that's happening across the world. We know that schools serve so many purposes, but one of them is that it tends to be a very ordered, routine, experience for children, that children really do thrive with order and routine. And so if there are opportunities, even as you're setting up virtual learning, to figure out how to make it sort of more of a routine for them, something that they can look to and be comforted by because they kind of know what to expect, that may be something that is useful and helpful. I think we also have to think about the grief and loss that families and children are impacted by. So many children, especially children in certain parts of our community, Ward 7 and 8, parts of even 5 and 6, where we have a lot of Brown and Black communities, there's been a lot of loss. There's been a lot of death from COVID, and that is traumatizing in and of itself. There's the element of grief and loss, and we need to think about the impact that that has with children and reach out to our provider community, pediatricians, even our behavioral health partners and experts, to better understand how to help children cope. One of the things that we know about trauma is that in addition to children encountering it, the way to help them recover from it or bounce back, if you will, is to look at the assets in their life and ensure that they're supportive adults, that they have the feeling of being understood and loved. And so looking at where are the assets and supports in the family and how can those things help in the family or community, but how can those things help a child really become resilient in the setting of what has just been so complicated, difficult, traumatic? I think is worth mentioning. Thanks, Dr. Jarvis.
Yeah, I couldn't agree more. I would just echo, what everyone has said, in that COVID-19, this pandemic, is a traumatic event or an adverse childhood experience, and so, my suggestion is just to create positive childhood experiences wherever you can. And if that means that you are going on a nature walk or having a FaceTime with grandma, or doing some socially distanced activity outside. And the routine also is very important. I can't echo enough how important that is to creating a sense of safety and security for children, having that routine, and that routine has changed, and it may continue to change. And so just being adaptable and really, encouraging as many positive experiences as you can in your day-to-day life.
Yeah, and if I can add something else, so just talk to your kids, ask them, what have you heard about COVID? What do you know about it? I think that's the best way to really measure how they are feeling. You will be surprised when you hear when they say, yeah, I don't want you to go to work. I'm fearful that you may get COVID, and that's not good. So just keep that door of communication open and ask your kids how they are feeling. And again, ask yourself how you're feeling. Ask yourself how you are coping with the stress and the uncertainty, because it will transpire how you feel to your kids and their behaviors.
I just wanted to add, in addition to the excellent points Dr. Cornejo, Dr. Bodrick have made, that there really is power in play, especially for younger children. So finding the space and time to allow your children to play, that's a part of their development, but it also tends to be one of those positive things in a child's life that help them cope in many ways. And there was a point made about going outdoors, maybe taking a walk, finding some opportunities while the weather is still conducive to go outside and play outdoors and get some green space. There's a lot of good studies that indicate that exposure to green space outdoors helps with sort of the psychological trauma and or uncertainty that we are encountering even now and right now with COVID. And then lastly, I just wanted to suggest that being outside, in fact, at least from what we can tell, there may be less risk as it relates to COVID. So certainly I'm not recommending being in a great big crowd of folks, but being able to social distance, maybe with one or two family members outdoors, maybe still keeping your mask on, actually not maybe, keeping your mask on. Those are also some things to consider as you think about ways to help in any way we can normalize or create, again, these positive assets to help your children build out their resiliency.
I definitely appreciate those points, Drs. Cornejo, Gill, Bailey, and Bodrick. I think, as I stated at the opening of this section of mental health concerns are just as important as physical health concerns. I truly believe that we've come a long way in mental health, but still have a long way to go. But certainly during COVID, reducing stigma and shame surrounding mental health concerns, I would just echo that they're very common, and we've been seeing more mental health concerns, anxiety, depression, PTSD, suicidal thoughts, certainly worsening, especially if people had those kind of underlying depression, anxiety prior to COVID. And you can reach out to, if you're a community facing or parent, patient, family facing organization, please ask these questions like Dr. Bodrick mentioned, or Dr. Gill Bailey, or Dr. Cornejo. How are you doing? Tell me about, what you're doing to cope in COVID. How are your children doing? Because there are resources available, whether that's social networks, potentially individualized therapy, group therapy, and now we have telehealth as well as options. So please reach out and get help if you need it or your child needs it. While we are flying through, the last but very important topic that we want to talk about today is schools. I know this has been a huge challenge for parents in particular. I'll kind of start off with Dr. Gill Bailey. I know the American Academy of Pediatrics has emphasized in-person return to school as a priority when it is safe to do so. Can you tell me why that's been such an emphasis?
Yeah, so absolutely. I think within the emphasis is when it's safe to do so, but provided that's in place, schools really are a part of the community. They're kind of a community center. But outside of that, specifically what they offer to children are opportunities for growth, development, health, and wellness, and really are offering services that aren't always secured outside of the school setting. So if we consider a child that, again, for some of the examples we've already pointed out, may have encountered abuse, that is something that would have likely been picked up in the school setting. When we think about children who are struggling with behavioral health or their mental health, those are things that we often see because they manifest in the school setting. On top of that, health and wellness is built out in the school setting. That's why school health is so important. And it's part of what's occurring day to day in the partnerships between your school health nurse or your school health personnel and your school leaders. On top of that, students who might have a medical condition or some health complexity really do receive services that increase their ability and or access to education, and also help begin treatments in areas where it's needed. When we think about the allied health professionals that are there in the school setting, physical therapy, occupational therapy, those important services are a part of a child being able to learn at their potential. And so that's what we're all interested here. And we know in the virtual setting, much of that's uncertain. Certainly IEP and 504 is important, whether you're in-person learning or virtual, but the method by which we provide health services or special services, some of those allied health services that I mentioned in the home setting, I think are still being built out. I think we're still trying to figure those things out. I know our school partners are working very diligently to ensure that they're working with families to make sure they have the supports that enable the type of access to education that virtual learning has to provide at this point. But when we think about all that in-person learning provides, we often take for granted how much is taking place right there in the school environment. And that's part of the reason, we could go on and on, certainly, but that's part of the reason I think that all of us as pediatricians recognize, understand, emphasize, and generally speaking, agree with the notion that children are better served and learn better, grow and develop more effectively in a school environment where they're able to engage with human beings, with teachers, and with their peers.
And I really appreciate those points. On the counter side, what are the safety considerations? What does safe return to school look like?
That's a great point, and certainly is not a question without a bit of controversy. And much of the way that question is answered depends on a really close-knit relationship with your public health experts who are monitoring the cases of COVID and the increase in cases and mortality and death from COVID. In the setting of community spread of COVID, the rate at which that is occurring, I do think we have to be very cautious about whether we can safely return children to school. There is some information we have available in the evidence so far, at least in children. We know children less than 10 years of age tend not to be as effective in spreading COVID, whereas students or children 10 years and older are going to spread the virus much more and very similarly to the way that adults would. With that said, regardless of whether your school community decides to resume in-person learning, there are certain features that must be in place. So the things that we know are that a face covering, a face mask is incredibly important. That is a very important way to prevent the infectious droplets from being in the environment and creating exposures for other children and other individuals in the school setting. Social distancing in classrooms, incredibly important. Establishing disinfectant protocols for frequently touched areas, incredibly important. Thinking about hallways and how children move through hallways and if they need to move through hallways. But if they did, giving some consideration to making it a one-direction hallway. So there are not children kind of encountering each other bi-directionally where they're going to kind of transfer, potentially infectious particles or have the opportunity to come in contact in a way that does not decrease risk of COVID. Lastly, I would just share that, many schools are working really, really hard and thinking really intently about how to go about ensuring children return to school safely and when is the time to do that. The other thing that I've seen many schools look at that is effective and that we have good examples in other nations is around smaller cohorts of students and ensuring that it's the same group of students that a child is with the entire day, that they can take lunch and meals in that same space, and that in the event that somehow a child is positive for COVID, as you think about contact tracing, you've limited it to this smaller group of children instead of having to worry about contact tracing across the whole school building, right? So having these smaller hubs or these cohorts enables a more effective method of determining positives and contact tracing that goes along with that. So we could go on and on, but there are many things that can happen to provide for safe learning. Using the evidence that's available. My colleague, Dr. Bodrick, talks about science and safety, and that's precisely what we're doing as we think about, when we can bring children back to the school environment.
I think that's so great. And I would, again, plug the DC AAP website, aapdc.org. We have a lot of school health resources on the website that go into detail about some of the topics that Dr. Gill Bailey was just talking about. We certainly could talk about schools for a whole nother hour, but I'd like to take the remainder of the time to jump into some audience questions. As a reminder, if you are watching and you have a question, please feel free to type it in. The first question that I have is not directed to anyone in particular, but it says, if I am notified by my child's child care center that someone tested positive, should I get my child tested while we are quarantining? And thank you for quarantining, actually. Who wants to take that question? Dr.
Sure,
Bodrick?
I can answer that question. So as I mentioned before, I would reach out to your child's pediatrician or primary care provider, and they can best help guide you on whether or not you should get tested. I think there are many pediatricians that would encourage you to get tested, but it really depends on your child's situation, also the capacity to test and our testing supply. So I would reach out to your child's pediatrician, but definitely continue to quarantine.
The only thing I would add to that is that once there is a positive case in a child care center or school, your public health department is going to engage in what's called contact tracing. So they're going to look at exposures, where they occurred, who was involved, and build out a group or list of individuals that they're going to need to reach out and contact. Outside of that, if you just do have concerns and want to review those concerns, Dr. Bodrick also highlighted some really great opportunities to do so. But generally speaking, if you were at risk, you would be contacted and told that you would need to have some testing done as well as continue your quarantine.
I think I might add too that some of the things that pediatricians are thinking about and public health professionals are thinking about is that science and safety. So questions such as, does your child currently have symptoms, fever in particular, but all of the symptoms Dr. Bodrick mentioned earlier. Was your child wearing a mask when they were exposed to the other child? Was the child who was positive for COVID wearing a mask? What was the duration of time that they were exposed? So did they have a lot of close contact, or was it the contact brief? Were they inside, outside? There are lots of considerations like that in terms of assessing true risk of COVID. I think that's great. Let's move on to the second question. So the question from the audience is, are the medical vans providing medical services in career at the public housing sites? What are the schedules?
That's a great question. So I can only speak on behalf of Children's Nationals at the ARC's medical vans, and we are currently just on site at our practice, 1801 Mississippi Avenue Southeast. I'm not sure about any outreach to any of the public housing sites, but that is an awesome idea. I'm not sure if my colleagues have any idea about that.
So I have not heard about sending the van out to housing sites, but echo Dr. Bodrick's comment that is an excellent idea. The group that I work with in school health and my colleagues have been doing some outreach with the ARC and the Anacostia Clinic around thinking about how can we utilize the van to provide services during this very disrupted sort of health landscape, right? And how do we overcome some of the gaps and barriers that COVID has placed upon us? And, the notion that we could look at actual housing sites and communities is a great option that I would personally love to explore, and certainly we'll take that back to see, how actionable that actually is.
Yes, thanks for the suggestion.
That's great. I think we have time for one more question, and this one was actually directed to Dr. Cornejo. It says, thank you, Dr. Cornejo, for highlighting the importance of supporting national policies that would alleviate food insecurity. Do you have advice for how providers can get involved in supporting such legislation, and what does our role look like?
Thank you for the question. Actually, organizations like the DCAP is a great way of doing this, involving on what they are doing, because usually we get all this information in terms of this policy that is being created. What does the DCAP think about it? I think reaching out to other organizations that can make a change on the community. I'm not sure if you want to do anything to that, Lenore.
No, I mean, I would echo that. I think that, there is certainly a role for advocacy in child health policy and legislation from all community members. And I would say that as a parent, as a member of a community organization, as a leader of a community organization, and, DCAP and certainly some of our hospitals as well have governmental advocacy committees that work just on that we try to address some of this policy on a state level. So for DC, that would be DC Council. And also, we're a tri-state area, so sometimes we consider Maryland and Virginia as well, but then also on the federal level as well. And then kind of like one other consideration would be within your personal organization. So for me, it would be within my emergency department division or within my hospital. What could we do to create policies and systemic change surrounding food insecurity? The last question, and I said I wasn't going to ask another audience question, but this is actually answered on the DCAAP website. So I'm not going to open it up to the panelists, but the question is, what metrics should school systems like DCPS use to determine if in-person instruction can resume? That is not a 1-minute answer, but some of the kind of policies and protocols surrounding return to in-person instruction can be found on aapdc.org. Dr. Bodrick, we have only a few minutes. You're a vice president. Would you like to provide any closing remarks?
Sure. So, on behalf of the DC chapter of the American Academy of Pediatrics, it's been a pleasure for us to, spend this past hour speaking with the community about these really important issues regarding children's health. Again, I just recommend that you, if you have any other questions or concerns, that you reach out to your child's pediatrician or your primary care home. And we have additional resources, as we said before, on the DCAAP website at aapdc.org. And we like to just keep this conversation going. So for any of the pediatricians or child healthcare providers out there who may be interested in joining our organization, you can also do that. And I just would like to encourage everyone to continue these conversations.
Thank you. And I would like to thank the mayor's office for this opportunity for us to speak today. And a special thanks to Drs. Cornejo, Gill, Bailey, and Bodrick for their time. All right, everybody, take care.
Thank you.
Thank you.